All right, today we're going to go over Cooley's disease. It's also known as beta thalassemia major. This is a condition you'll see in pediatrics and hematology, so let's break it down together.
I've heard about that, but what exactly happens in Cooley's disease?
Well, that's a great question. Cooley's disease is an inherited disorder where the body can't make enough beta globulin chains, which are part of hemoglobin. Without those chains, the red blood cells are small, fragile, and they break down really quickly. So this causes severe chronic anemia, and the body tries to compensate by expanding the bone marrow to produce more cells. This leads to some of the characteristics, the bone changes that you'll see in these patients.
So, who's more likely to have this condition? Is it linked to lifestyle?
Well, no, it's not linked to lifestyle at all. It's strictly generic and autosomal recessive, so that means both parents must carry the gene. It's more commonly seen in people of Mediterranean, Middle Eastern, South Asian, and African backgrounds, but anyone can carry the gene.
What signs or symptoms would make me suspect Cooley's disease in a child?
Well, with that, you'll usually see symptoms in the first year of life. So you'll see severe fatigue, pallor, lethargy, poor feeding, and failure to thrive is another one. Jaundice and an enlarged spleen or liver, irritability, and then bone changes in the face or the skull over time. There is also delayed growth development, and all of these are ongoing symptoms and with the body's attempt to compensate.
How do we confirm this diagnosis?
Well, we'll use a combination of tests like CBCs to show like your hemoglobin levels. The peripheral smear shows a target cells and their irregular shapes, so you could use the microscope to do that. And then you have electrophoresis, which confirms abnormal hemoglobin patterns. But of course, there's always genetic testing. Iron studies are done just so we can distinguish from iron deficiency and monitor the overload, which sometimes happens.
What does treatment look like? Is there a cure?
Well, treatment focuses on replacing the missing healthy RBCs and preventing the complications, of course. So we'll treat with regular blood transfusions every 2 to 4 weeks and chelation therapy to remove the excess iron or other metals in the that the transfusions might give them. Folic acid, of course, iron supplements, and you could possibly even have stem cell transplants or bone marrow transplants. You might need a splenectomy too if it really affects the spleen. The child may have to go through that and have the spleen removed.
As a nurse, what should I focus on during my care?
Well, you'll want to monitor the patient's hemoglobin, of course, and their ferritin and their liver enzymes. You're also going to want to check their vital signs. You're going to watch closely for any transfusion reactions when you're doing the transfusions as well. It's super important. You're going to make sure that they adhere to their medications, as well as their iron chelation medications. And then you're going to keep an eye out for any type of infections or anything that might occur with the spleen, so we could get on top of that prior to it getting really bad. You're going to want to track the growth and development of your patient as well. And of course, you're always going to want to provide emotional and support with the patient and the family and make sure that they get the right diet and nutrition.
What should I include in a patient or family education?
Okay, so you want to teach the family that it's important to not miss those transfusions. Those are very important, and why chelation therapy may be needed. You're also going to want to teach them the signs and symptoms of complications such as dark urine, fever, chest pain, severe fatigue. The need for vaccinations is especially important for children. So especially if they have to have their spleen removed, because that, helps with immunity. You're going to want to know how to teach them. You're going to want them to know how to manage their nutrition,
Right.
and how to focus on iron related type nutrition unless there's a limitation because they have an iron overload. So you're going to want to know when to seek emergency care as well. So you'll tell them, if they get to where they're really fatigued or they start having some of the signs and symptoms that are a little bit off, they'll need to go and see their doctor.
Right. What complications should I monitor for over time?
Well, the most common long-term complications are related to chronic anemia and the iron overload. So you'll want to keep an eye out and teach about heart disease such as cardiomyopathy, liver damage from the iron accumulation could happen, endocrine disorders like diabetes, delayed puberty, hypothyroidism, infections, especially after that splenectomy, like we already said. And you want to have them to keep an eye out for bone deformities or fractures. And gallstones could be a problem. Regular monitoring can help find these early so you can get on top of it.
Right. This is a lot to remember, but it's starting to make sense.
Oh,
What's
good.
the main takeaway for me as a student nurse?
Well, for that, the biggest takeaway in Cooley's disease is it's a lifelong and it requires consistent, coordinated care. Your role as a nurse is vital. You'll be monitoring for labs, supporting treatments, and preventing complications and educating the families, which is super important. And with strong nursing support, patients can have really excellent outcomes.
Well, thanks for teaching me about
You're
that.
very welcome. I look forward to seeing you again.